PML, which stands for progressive multifocal leukoencephalopathy, is a very serious and severe disorder that is associated with uncontrolled replication of a virus known as the JC virus. PML has been recognized for many years and is associated with a variety of underlying conditions and drug treatments. So, for example, PML is known to occur in the context of HIV and various blood cancers, but it's also, in particular, in recent years, been appreciated as a side effect of drugs used, particularly in the treatment of multiple sclerosis, MS, but also in other conditions. What's challenging about PML is that it's not enough to be positive for the JC virus, which is an absolute requirement to get the condition. People who don't have JCV virus cannot get PML. It's not enough to have JCV and to either have one of the underlying conditions or be on one of the drugs. But there must be something else at play, because only a minority of individuals who have one of these underlying conditions or are treated with one of these drugs will actually develop PML. So, for example, in patients treated for MS with Natalizumab, only a small percentage of individuals will develop PML. The vast majority do not. So we've been thinking about this conundrum for many years. And largely due to my background in medical genetics, where we're interested in rare diseases, I was reminded of a condition that I learned about earlier in my training, which was a condition called X-linked lymphoproliferative disorder, or XLP. And XLP bears some similarities because XLP is, again, a very serious condition that can be fatal, that is due to an inability of individuals exposed to Epstein-Barr virus, which is a very common virus in the population. And by the way, JC virus is also very common in the population. Anything from 40 to 80% of the worldwide population carry JCV. And what's interesting about XLP is that some years ago, people identified two different genes, both on the X chromosome, such that mutations within those genes confer the risk of XLP. And so because it's on the X chromosome, it only affects boys. So the constellation of an underlying genetic predisposition plus infection with a specific virus leading to a serious result formed the basis of a hypothesis that we decided to apply to the question of why some people, only a small number of people who are on natalizumab or who have other underlying risk factors such as HIV, why only a small percentage will develop PML. So we sought out to test this hypothesis by looking for mutations in genes that are strongly involved in the immune system. Unlike other studies where people have performed whole genome sequencing or whole exome sequencing and are looking for variants in any and all genes, we didn't do that. We had a very specific collection of genes that we were going to focus on, which is much smaller than the 20,000 or so genes in the human genome. And so with this focused approach, looking at genes that either are known to cause immune deficiency disorders or else are known to be important in the immune system, we identified a set of variants in genes that, according to our studies, increase the risk of PML across the board. So it doesn't matter whether you've got HIV, whether you're on natalizumab, whether you've got any one of the other underlying disorders, these variants are important.